Well, it's been exactly 6 months since the first case of Covid-19 was reported in Nigeria. Over the past 6 months, public and private healthcare facilities have been doing their very best to protect us all and save as many lives as possible. Arise correspondent Laila Johnson-Salami visited First Cardiology Consultants Hospital here in Lagos to find out how the medical team is feeling and coping since 6 months later.
It's been 6 months now since the first case of the novel coronavirus was detected in Nigeria. Since then, we've had over 50,000 confirmed cases. About 36,000 people have survived, and unfortunately, we have lost about 1,000 lives. I'm here today at First Cardiology Consultants. This is where a lot of high-profile Nigerians have opted for treatment for COVID-19. Few have unfortunately lost their lives here, and several have been saved here. So I'm here to speak to the team, particularly the Chief Executive Officer, Dr. Yemi Johnson, with regards to what the past 6 months has been like and how operations have transitioned for the hospital due to COVID-19. Let's head in and find out. As I walked in to First Cardiology, I was met by Dr. Yemi Johnson, the Chief Executive Officer of the hospital. He's been on the front line here for the past 6 months. He took me into the cardiac catheterization laboratory. This is where procedures such as angioplasty, pacemaker setting, and the opening up of blocked arteries are done. Before our interview, he explained the use of the ECMO machine to me. This machine is used to bypass damaged lungs, and it's been crucial to the hospital's fight against COVID-19.
Well, it has been, I'd say, interesting and rough, because as you might know, we look after ICU patients, so we get the sickest people, and it has been extremely, extremely difficult. Because these patients come in very sick, and there are a lot of expectations, but then the disease is, when it gets to this stage, it's nasty. So the best thing is not to get it. But it has been difficult. We were sort of expecting it, because we saw what was going on around the world. And my partner and I decided, look, there's no way we're going to escape this thing. Let's get ready. People thought we were crazy, but we said, look, and we also knew once people got sick, they're going to come here. So we set up our hospital to get it ready. And at the same time, Lagos State came and inspected and accredited us. Yes, I've seen some of the news going around, and I find it interesting. But truth is, we do have numbers that we keep, and numbers are kept with. We report every case to Lagos State, because accreditation is directly, we're supervised by Lagos State. So everything we do, we report to Lagos State. We give them a daily report. And so far, out of our 52 patients, we've had 8 who did not make it. So that gives us a survival rate of about 84, 85%. For instance, just using numbers, a drug that used to cost $100, 100 naira, now costs 1,000 naira. And that's not necessarily because the pharmacists are trying to make a quick buck. It's the supply chain has been disrupted. So it is difficult to get things in, very difficult. And then, unfortunately, in Nigeria, 99% of all the consumables we use are imported. 99.9%, I think. And I even heard the chief of NAFDAC saying, even those things we make, drugs we make, most of the things we use to make the drugs are also imported. So we've got to fix that problem, but it has really made things very expensive. For instance, one of the drugs we use that many people have heard of, remdesivir, it costs us 450,000 naira a dose. And most patients need 11 doses. So if you work that out, it's about 5 million naira for just one drug. So you can see this is, it's difficult to treat, considering we import everything. We don't make most of the things that are required. Luckily, it's a great challenge. It is very expensive. Luckily, we hear WHO is planning some research, and we might be able to get that drug free. So that would be a big help. And then there are the other drugs and all the other consumables, the PPE, all these things. They're all costing 10 times, 100 times more than they used to cost before the pandemic. So we're all working out the best modalities and the safest way to do this.
To find out more and to get more perspective, I decided to also speak to Dr. Kofo Ogunyaki, a non-interventional cardiologist and the medical director at First Cardiology.
It's been strange and stressful, but gratifying in a certain way because it has allowed us to showcase what is feasible when you have people with the right training and resources to practice cardiology at the same level as elite centers anywhere in the world, have the challenging cases that allow us to really do things that we ordinarily wouldn't have reason to do. The heart and the lungs, we probably should remind ourselves, occupy the same real estate inside the chest. And it would have actually been unusual if the lungs would face all this trouble with the heart being spared. And it turns out heart is never spared.
After my discussions with the leading medical team, Dr. Ogunyaki explained a few more things to me as I waited to visit the intensive care unit, where 52 coronavirus patients have been attended to so far. As Dr. Johnson stated in our interview, the survival rate here has been quite high compared to the survival rates in ICUs across the world. 85% of First Cardiology ICU patients have survived. Before going into the ICU, I was given personal protective equipment to put on. Using PPE and wearing it properly has become so crucial in the fight against COVID-19. The doctors instructed me on how to wear the PPE and also provided me with a new ventilated face mask, as they are the only ones allowed to be worn into the ICU. Inside the ICU, there were 2 coronavirus patients. Dr. Johnson explained that one patient was fully recovered and ready to leave, while a second patient did not appear to be in great condition. I learned that the patient had just woken up from life support the day before, and although she was thankfully getting better, it was a reminder of just how dark and dangerous this virus is. Dr. Amina has been working in ICU here for the past 6 months. Here's what she had to say.
I'd say challenging. I mean, when this started, we didn't know the extent of the pandemic and how far-reaching it would be. And seeing patients coming, because we mainly manage the severe cases, really seeing them evolve, really, because this is, as we know, a novel disease, and seeing it evolve and seeing so much that you have to do for these patients, and seeing some of them, survive, seeing some of them, as you know, not survive. It's really been a challenging experience, but really been eye-opening, rewarding in its own way too. It's just been, I try not to think of it too much. I mean, medicine in itself can be emotionally tasking, but during this time it's been tough sometimes, but you come in every day trying to do well by your patients, and that's what really drives me and the doctors here personally,
I also decided to speak to patients who'd survived here.
All I have to first of all say is that this thing called Covid-19 is real, and I went through what I would call, a hellish experience, but for the grace of the Almighty Allah, and we also have to give a lot of credit to First Cardiology. I would say my life was spared, because I really had serious pneumonia, and it affected a lot of my organs and the rest of it, and I would say, I can only be grateful and thankful.
Regarding that, I'll refer you to a conversation I once had with Dr. Yemi Johnson, one of the principals of First Cardiology. I saw him while I was still here before my discharge, and I said to him, I don't know if you build your people or buy them, but whatever you do, keep them. And he said to me, you know what's even more interesting? Everyone in that ward is a volunteer. And why did I say what I said to him? They weren't only professional, they were extremely kind. I continued treatment at home. And at some point, I realized that I was getting so bad that I couldn't continue treatment at home. So I came here. Well, for the first day, the last thing I remember, the first day was I was wheeled in and they were trying to change my clothes, and that was it. The next time I opened my eyes, they were asking what my name was, if I had children, what their names were. And they asked me how long I thought I had been, here for. And I said 2 days. And they said, you've been here for 8 days.
For the post-hospitalization, same thing as well as we are coming over here. They're just checking very properly. They're checking thoroughly. And then they say, okay, have this test, have this test. Even if some facility is not available with them, they will say, okay, go to that particular doctors. I have seen Ebola here. I was at the time of Ebola. I was at the time of Nigeria is fully prepared because they had the experience of Ebola. Immediately when this thing came, all over the airport, all over everything, they were geared for it because Ebola has prepared them very, very well.
That was certainly a theme that echoed across all conversations with First Cardiology patients. Kindness. Many who survived here had awful experiences with COVID-19, but great experiences with the medical team and felt protected by the doctors around them. A majority of Nigerians depend on private healthcare facilities, and the ability for private healthcare facilities like this to provide has proven crucial to our fight against COVID-19. This hit us all unexpectedly, but the team here at First Cardiologists and all across Nigeria continue to do their very best to save us from this common enemy. Laila Johnson-Salami, Arise News.